time. So this is a lumbar spine, and I have seen a disease already. What about you guys? It says here, I can't read because whoever wrote it in a way that it doesn't look like it's proper writing. So it's just impossible to figure out whatever is written in the exam request order. It says she has some kind of nerve root disease. It doesn't say on which side it is. They just say it is. So this patient is a female. She is only 19 years of age, and she is supposed to have a severe neurological disease of the lumbar spine. This is a T2 without fat saturation. She is quite fat. So clear signs of obesity right there. She is clearly obese. So let's look for inflammatory acute diseases, since it's very rare for such a young patient to have chronic degenerative disease of the spine. So it's either trauma or some acute disease that should be as painful as anything else on the lumbar spine. So this is a T2 without fat saturation. This is a T2 with fat saturation right there. It's in STIR, steer sequence. And this is a T1 right there. So obese. Her lumbar spine seems quite normal. There is no signs of dehydration of the discs. Just a little bit right here, maybe something right here and a bit here, but it's very common at her age, so nothing major. I know you guys have seen this already. These are a few meningeal cysts, nothing major. There is some not destruction, but there is some deformity of the sacral canal. This is quite common because this is a slow growing persistent lesion. Just going to write that down. It's 4.7 by 2.0. All right. Yep. And there is no protrusion or extrusion. The spine, the medulla, the spinal cord is well positioned. The nerve roots as well. Oh, I'm so sleepy. I'm sorry. Been a rough night. So there is hypotrophy and fat infiltration of the perivertebral muscles. This is a sign of, could be a sign of chronic denervation if we had any features of nerve root damage, compression, inflammation on any of those segments, on the upper segments, before these muscle features show up. But we have here two signs of painful lumbar spine, which are degenerative disease of the facet joints. As you guys can see, there is sclerosis, small osteophytes, and hypertrophy of the facet joints. And we have fluid accumulation. We have joint effusion right there on most segments of the lumbar spine, which are easier to see here on the STIR, the steer sequence. Right there, right there. See? There is joint effusion. There is a sign of synovitis or hypermobility or overload of such joints, since they also show signs of degenerative disease, of arthrosis, mild arthrosis. We can say this is probably the cause of the pain the patient is complaining about. Also, I have a slight edema of the interspinous ligaments right there on L5, L4, L5, S1. From L5 to S1 right there. This is quite normal. This is a bit too bright. Remember, you can't really tell on anything else than the fat saturated sequence, because fat and liquid are quite similar, so it's hard to tell unless you have fat saturation. Hello Holden, welcome. What's up, mate? So let's go for arthrosis, synovitis, and slight edema, and these meningeal cysts right there, and we should be good to go to the next exam. So I will also have hypotrophy of the perivertebral muscles, and I have to describe the cyst inside the sacral canal. So let's summarize: mild arthrosis and synovitis of facet joints, edema of the interspinous ligaments from L3, from L4 to S1. Just copy and paste and remove a few words because it's easier. And hypotrophy of perivertebral muscles. And we are done. I guess we can tell this patient has indeed been suffering of lumbar pain, just as she says. Nothing major, nothing surgical, just regular overload of the spine.